Okay, thank you everyone for your patience and cooperation. We will now continue to live record the public comment session. As a reminder, your recorded comments will be distributed to the MTA board and will be posted to our board meeting webpage and YouTube channel. Our next speaker will be Alita Dupree, followed by Anna Pacman.
Thank you, Chair Jano Lieber and members. Alita Dupree for the record. My pronouns are she and her. Need a clock here, it would help. I'm gonna echo something that another speaker said, in that the additional public testimony was not published to the YouTube website. And I hope that can be corrected, as well as the minutes being approved with the additional public testimony. And I would hope that today's additional public testimony will also be published on the MTA website and delivered, because this is public record and everybody should be heard equally regardless of the time that they speak. And I did write an email about it and I hope you got to read it. So anyway, on to other things. I hope to be back on the system soon. I keep saying it, but I have issues, but I want to get back. And I'm going to use Omni and I'm going to pay full fare, because even though I have a reduced fare MetroCard, don't want any more damaged MetroCard stories. So I hope we can get reduced fare on Omni soon. I have an Omni account and I'm going to link my Visa card to it. And ADA is essential. And as much as I can climb stairs, many can't. And I hope I'll always be able to climb stairs, but I want a system that everyone can participate on fully. And I'm not going to be afraid to ride the subway. I'm going to come back to New York. I'm going to use it often. I do wear a mask. That is my choice. And I'm going to keep wearing it as long as I feel I need to. And I've been on crowded buses and trains in other cities. And I'm going to get out there and do it and encourage others to do the same, because this is a system with a rich history and tradition and of stately and legendary ideals. And it's a defining institution of New York. And for me to fully participate in New York in my business, I ride the subway. So thank you again, and let's get these meetings posted. Appreciate it.
Thank you. Our next speaker will be Anna Pacman, followed by Akgar Gasabine.
Thank you. My name is Anna Pacman, and today I'm here in my personal capacity to talk about COVID safety. I have a disability that puts me at high risk of developing complications from COVID-19. And like 3/4 of Manhattan residents, I don't have a private vehicle and rely on the MTA to get around. By making the whole system mask optional, the MTA has taken the option of using these services away from me and other disabled, immunocompromised, elderly, and vulnerable New Yorkers and visitors who need to avoid exposure to a virus that is still dangerous and potentially deadly for us. I'm here to ask you to restore choice and to create equitable access to public transit by reinstating the mask mandate, or at the very least, a compromise. Establish at least one mask car per subway or commuter train, much like Amtrak has a quiet car, and allow Access Ride customers, most of whom only qualify for this service because of conditions that actually make them high risk for COVID, to request rides where everyone in the car on those trips is required to mask as a reasonable accommodation. High quality masks are great, but many studies have shown that masking is more effective when everyone in an enclosed space wears a mask covering both nose and mouth, which, by the way, is the only correct way to wear a mask. And masking is even more necessary when it's used as a source control when the infected person is the one wearing a mask. And speaking of correct mask use, the new signage in the city that has seen 14 9/11s worth of COVID deaths is offensive and should be removed immediately. More contagious variants are on their way, and the MTA signs undermine future public health efforts that will inevitably need to happen. And these signs will be the reason some people die or become disabled. When you leave this meeting, you have two choices. You can choose to save lives, or you can do nothing. Do the right thing. Thank you.
Thank you. Our next speaker will be Akgar Gasabian, followed by Ian Rasmussen.
Good morning. I'm Akgar Gasabian, Assistant Professor of Pediatrics, Population Health and Environmental Medicine at NYU School of Medicine. My scientific research involves investigation of environmental exposure and their impacts on children's growth and development. New York City is the first jurisdiction in the United States to implement a congestion pricing plan, but this is not a new idea. Similar policies have long been in place in other cities around the world, and research has consistently showed that they reduce air pollution levels. For example, shortly after implementation of a similar policy in Stockholm in 2006, nitrogen dioxide and particulate matter concentrations dropped by 10 to 20%. No such declines were observed in comparable urban areas that did not implement a congestion pricing policy. In London, a congestion pricing policy was implemented in 2003, and nitrogen oxides emission decreased by 12%. Nearby neighborhoods also saw a benefit in the form of reduction in particulate matter. These numbers are impressive, but what do they mean in terms of health? In Stockholm, rates of asthma-related doctor visits among young children dropped by 6 visits per 10,000 children relative to control after policy implementation. In London, it has been predicted that there will be a gain of more than 170 years of life per 10,000 population. Here in New York City region, modeling studies consistently predict similar or greater improvements in air quality, which can substantially improve the health of children, older adults, and pregnant women. With careful attention to design of the tolling system and simultaneous improvement in public transport, the congestion pricing plan in New York City has a strong potential to reduce traffic-related air pollution in the congestion zone in neighboring areas, some of which are the most heavily impacted by diseases such as asthma, and in the greater New York City metro region. Thank you.
Thank you. Our next speaker will be Ina Lakshina. Ina Lakshina, followed by Jasmine Smith. Ina? Okay, we'll come back. Our next speaker will be Jasmine Smith, followed by Myra Batchelder.
Hello, good morning. My name is Jasmine, and I'm here to ask the board to reinstate and enforce the mask mandate on the MTA. Optional masking is forced infection. Wearing a mask correctly when in public is the lowest bar to clear, and yet somehow we are failing at that as a city. I was a contact tracer for New York City Health and Hospitals for over a year and spoke to countless New Yorkers sick with COVID, some dying, some with loved ones already dead. I spoke to people who could not avoid infection no matter what they did because others made the quote unquote personal choice to expose them by not masking. Removing mask mandates and adopting a you do you mentality makes all of us less safe, especially medically vulnerable people. Saying optional masking is sufficient is not true. In New York State, there have been nearly 71,000 dead of COVID. In New York City, it's almost 42,000 people. And that's just the official number, which is definitely an undercount. I personally have family members dealing with mental and physical impairment months and years after their first COVID infections. COVID is not a cold, it's not the flu or some minor illness. Just because something can feel like a mild infection in most people at first does not mean that it is mild or no big deal in the short or long term. Just Google post-viral illnesses or post-polio syndrome to get an idea. Most people with polio think they just have some slight diarrhea at first if they have any symptoms, but up to nearly 40% of those will develop serious long-term complications according to the CDC. Who knows what the COVID numbers will be in the future? I'm asking you, put public health first, not money and politics. Do the right thing, not the popular thing. Reinstate and enforce the mask mandate on the MTA so we can all get to where we need to go safely. It's the least that
Please conclude your remarks.
It's the least you can do, and it's the least we can do. Thank you.
Thank you. Our next speaker will be Myra Batchelder, followed by Julia Raifman.
Hi, thank you. My name is Myra Batchelder and I work in health policy, and I'm here today to urge the board to reinstate the mask mandate on the MTA. COVID-19 community transmission is still high in New York City and surrounding areas, according to the CDC. And COVID rates are undercounted because home tests aren't counted in New York City and other counties. COVID rates are already on the rise in New York State. Experts estimate we may have around 100 million new COVID cases this fall and winter in the US. Now is not the time to end the mask mandate on public transit. If you own a car, mask mandates on public transit may not seem like a big deal. But for millions of us in New York City and the surrounding areas who don't own a car, it is a very big deal. We rely on public transit to travel to medical appointments, work, school, and other places. In midst of high COVID community transmission, ending the mask mandates on public transit has made our lives more unsafe. No one should have to risk getting COVID-19 in order to travel to medical appointments, work, school, or other places. For those of us at higher risks for severe COVID, the risk is intensified. Speaking personally, I'm now postponing medical care because there isn't a safe way to travel to access it. In addition, it's important to point out that everyone is at risk from COVID. Long COVID and serious health issues can happen to anyone. We urge you to reinstate the mask mandate on the MTA and set up a public education campaign that shows the importance of wearing a mask on public transit. Thank you.
Thank you. Our next speaker will be Meredith Kahn, followed by Jacqueline Cohen. Meredith Kahn.
Hello, my name is Meredith Kahn. I'm a social worker in Northern Manhattan, and I'm here to urge the MTA to reinstate mask mandates on public transit. I depend on the subway to get to work. Since the mask mandate was lifted, I have felt significantly more unsafe. I wear my N95 on the subway. But if other people aren't masking, it can only do so much. I depend on the subway to get to work so I can work with my vulnerable clients. Luckily, my place of work still has mask mandates in place, but it's so dangerous not to have these mandates or be enforcing them anymore on public transit. Cases are already going up in New York City. The cases are going up in schools and children are getting it. The recent campaign that shows the "You Do You" sign, where it's all cutesy, and it's like, I saw that for the first time and it made me so angry that we're purposely spreading misinformation and making a joke about it. Like, the COVID is still out there. Long COVID is real. There are going to be so many more new disabilities and deaths because of this, because of taking away the mask mandate. And it's absolutely unacceptable. We need to do better. We need to protect New Yorkers. Just please reinstate the mask mandate. Please take the lives of disabled people seriously. Thank you.
Thank you. Our next speaker will be Jacqueline Cohen, followed by Gita Sabo.
Hi, thanks very much for your time. I'm a regular commuter, at least I used to be, and I want to be. And as other speakers have described, I'm here to urge that the mask mandate be reinstated on public transit. I commute between New York and New Haven, and also between Manhattan and Brooklyn on the subway, but not as often as I used to. I am at high risk for severe disease from COVID due to a chronic illness. My partner is immunocompromised. Until a few weeks ago, I felt pretty safe on the MTA especially compared to other mass transit. Because there was a mask mandate, there was accurate signage describing how to use a mask. And I noticed that many other folks around me on trains were masked. As previous speakers described, it's easier to choose not to wear a mask when there isn't a mandate. And the more people who don't mask, the less safe myself and my family are, and the less safe the most vulnerable people in our community are. And that really scares me. I have several close friends here in New York City, most of whom were not immunocompromised, who contracted COVID and are now disabled due to long COVID. If that were to happen to me with the effects it had for them, I probably wouldn't be able to do my current job. And that's a risk that everyone faces if we don't protect each other by wearing masks. We know that COVID is airborne, so two-way masking is the best protection against transmission. And per data, community transmission of COVID in New York right now is high. So I would be very grateful to see the mask mandate reinstated on public transit. I depend on the subway and on Metro North. Without a mask mandate, I've felt like I had to choose to avoid trains and buses and use more environmentally unfriendly transit and more pricier transit like cars to keep myself safe and to keep my family safe. We all come together on public transit in New York and we deserve to be safe there. So I urge the MTA to reinstate the mask mandate and put up signs with accurate information about masking to keep us all safe. Thank you very much.
Thank you. Our next speaker will be Gita Sabo, followed by Michael Ortiz.
Hi, MTA. My husband is a transplant recipient. At the beginning of the pandemic, his hospitalized transplant recipients had a risk of dying as 1 in 4, 25% risk of dying from COVID. With all the progress we have made, the latest statistics show a risk of death for him now as 1 in 12. That is not good. 409 Americans died yesterday. The vast majority of those folks were high risk. By removing the mask mandate on trains, we are basically removing the high risk and their families from society. My husband deserves to be able to ride the train safely. Cancer patients undergoing chemo, as we heard about earlier, deserve to be able to ride the train to their doctor's appointments. High risk folks heading to work deserve to be able to ride the train without risking their lives. My family can skip restaurants and bars and concerts and parties indefinitely, I guess forever, but we cannot skip school or doctor's appointments or the train. The subway is a mandatory space for all New Yorkers. At a minimum, we need to have masked cars on each train to make it possible for high-risk folks to be able to leave their homes. Anything else is unacceptable. Thank you.
Thank you. Our next speaker will be Michael Ortiz, followed by Diego Orozco.
Can you hear me? All right. I hope you're all staying cool on this nice hot day. I'm disgusted with the violation of the meeting rules that's been happening lately. A certain individual has been spreading lies and slander recently on the Monday's Finance Committee. And just recently, someone's address has been getting leaked on the internet. And it happened on Monday's Finance Committee. And it's unacceptable that you allowed someone to leak someone's address out on the board meeting. It is unacceptable. We've been complaining about the constant violations of the meeting rules by a certain individual. And not to mention, dozens and dozens of rail fans have been constantly getting harassed. We are not dealing with this anymore. Another thing that's been happening is the subway surfers. Subway surfers have been continuing to be in our subways, standing on top of the trains, and it's completely unacceptable. As for the bus redesigns need to be spaced. The bus stops need to be spaced every 3 blocks. They cannot be spaced every 5 blocks, as it's too far for other people to walk to a bus stop. It should be spaced every 3 blocks. Other than that, that concludes my remarks because I'm disgusted with the violation of the meeting rules that have been happening over the past few months. Thank you.
Thank you. Our next speaker will be Diego Orozco, followed by Andy Pollack.
Hi, my name is Diego Orozco. I'm talking as a concerned citizen. I want to start by getting straight to the point and asking Chair Lieber and the board to please reinstate the mask mandate. I've been here in this meeting listening from the very beginning to many women, many concerned individuals, medical professionals, and the funny thing is that taking notes on everyone that's spoken, most of the people have spoken through their own personal risk. I myself am a cancer fighter. I was diagnosed with acute myeloid leukemia in 2019 when I was 25. And seeing the way that disabled people have been left behind has been disheartening, to say the least. But I think the most important point now is that on something that is as inclusive, or should be as inclusive, as mass transit, public transit, the priority should be public safety. And I want to speak on that, because mask mandates do work, and COVID affects not just those who are disabled, but those who feel they may never be, those who are abled, those who work, those who commute. A recent poll published on CNBC online was stated to say almost 1 in 3 that are polled are afraid of catching COVID on their way to work. And I'm listening to people here who have breast cancer, who have their own immunocompromised partners, and they're afraid to even go about their lives. So I'm asking, and I'm speaking as a concerned citizen, to please reinstate the mask mandate. I have my video on. I'm showing proudly my port here on my chest. This is something that I still fight every day. And I think instead of messaging that you do you, it should be more important that we got us. Thank you very much.
Thank you. Our next speaker will be Andy Pollock, followed by Deborah Sokolar.
Good morning. For the record, I am Andy Pollock, and I am a member of Passengers United. Also, for the record, there will be higher quality audio of my comments on my YouTube channel, Andy's Randomness. So let's get down to business. Number 1, finally, the cameras are coming on board to the subways. This has been long overdue. My organization has been pressuring Governor Hochul now for the past year to get this done. She's finally budged, and if the governor's paying attention, thank you very much. I know it's going to take time to get the cameras on all the cars, but they've already done it in Seoul, South Korea, and that has worked out very well for their public transit system over in Asia. So we're following South Korea's lead for once. That's very, very good. Okay, second, regarding congestion pricing, I was speaking to Neil about it back on Monday, and I forgot to mention that I would also like to see an exemption for taxi drivers, limos, Ubers, and Lyfts, because you guys are basically going to take away their livelihoods. And if we have to charge the $23 maximum for the other drivers to get these exemptions in, by all means, let's do that. So that's my second point. And my third point, and I actually have a message from Nassau County Executive Bruce Blakeman. Bruce has been suggesting that for one day or maybe at least 1 week to be reasonable, that commuter rail line fares on the Long Island Railroad and maybe even Metro North, we should lower them 1 day to what the prices were back in 1982 or 83, since the M3s are going to be coming back to the railroad once Grand Central Madison opens up. So let's look into that idea. Maybe that can be done during the holiday season. So that's all I have to say to the board for this month. Thank you all very much for letting me speak.
Thank you. Our next speaker will be Deborah Sokolar, followed by Lorraine Kim.
Hello, my name is Deborah Sokolar. I live in Morningside Heights near the #1 train. I hope you can hear me okay despite my vocal cord disability. I have a master's in public health and know well the value of prevention. I urge you to drop the appalling "you do you" message and to restore, publicize, and enforce the mask mandate for buses, subways, and commuter rail. This mandate is vital to protect passengers, MTA workers, and everyone they come in contact with. Given your obligation to serve people with disabilities, you must enable the many people with weakened immune systems to use mass transit. To protect everyone in New York against long COVID, we need masking to help stop the spread of the virus. I myself had a very mild case of COVID over a year ago and still have greatly diminished stamina. I fear repeat infections, which cause cumulative damage. With people not wearing masks on crowded buses and trains, I must avoid mass transit. So now, except for rare occasions when I can afford a cab, I'm confined to where I can walk, a small area given my limited stamina. The whole MTA urgently needs upgraded ventilation, but while we await that, we need a mask mandate. Some assume the pandemic is waning, but worrisome new variants are already arising. Remember the precautionary principle. Masks work, mandates work, leadership works. Please restore the mask mandate for all of our health and safety. Thank you.
Thank you. Our next speaker will be Lorraine Kim, followed by Iman Ramawi Doster.
Hi, thank you for your time today. I'm here to speak on Governor Hochul's dropping of the mask mandates on public transport. And I'm sure we all here have heard President Biden's proclamation that the COVID pandemic is over. But the fact is, an average of 500 Americans are dying every single day. And this is not even accounting for delayed symptoms after an acute infection. I'm here basically, I'm not disabled. I've had COVID twice. I've had relatively a positive outcome, but I do not feel safe riding the New York City subway. And when I do ride it, I have to do absolutely absurd things. So I'm here just to say some facts, and these are all substantiated by articles. For example, the Wall Street Journal in December of 2020 published an article about relative humidity and why during the winter time the virus can linger in the air. If it's cold enough and there's not enough humidity, and as we all as New Yorkers know, it gets dry here, it can linger in the air for 26.6 hours. Last year when the Delta variant was around, the reproduction number was approximately 4, which means each person could infect 4 other people. Now, there's some debate on what the reproduction number is these days, but last I heard it's about 18.6, which means one person can infect 18 other people. And double masking is absolutely necessary. And I understand that people will not follow the rules on MTA, but you also have to understand there's a social behavior part of this all. A lot of people want to mask, but if they see people not masking, they don't want, they're not going to mask. There was a study done in April, I think a survey, and it was 56% of Americans approve or want transport mask mandates. And a lot of people won't do it if other
Please
people
conclude your remarks.
So anyways, Germany has put a mask mandate for October to
Please
April.
conclude your remarks.
And I hope that New York does the same and that you can stop all these deaths.
Our next speaker will be Miriam Grossman, followed by Miriam Fisher.
Good morning. Thank you for having me. I'm someone, I live in Connecticut. I take Metro North, and when I go to New York, I take subways and buses. I also support reinstatement of the mask mandate, but acknowledge that, since the TSA dropped their mandate, the mask mandate at MTA has been, very sporadically enforced. Only one bus I've been on, in August at Q65, the driver actually enforced the mask mandate and handed every passenger a mask if they didn't have one. That being said, I would like the mask mandate, but I acknowledge that the enforcement that was happening pre-Governor Hochul's announcement was simply not there. So it gave people maybe a false sense of security. So I would like a mask mandate if it's enforced. But even if you're not going to go full on mask mandate again, you can consider having a mask mandate for accessorize for people who are elderly and disabled who rely on it for transportation. So the most vulnerable are protected. You can consider having mask only Metro North, Long Island Railroad cars. So people who wish to wear a mask can congregate in with other like-minded people. And you can also change that awful marketing to the You Do You campaign to at least acknowledge that mask wearing is helpful and to educated about proper mask wearing and not to mock the whole practice entirely. So at minimum, at least be encouraging people to wear masks and not mocking the idea of wearing masks improperly or not wearing them at all in the UDU campaign. Thank you for your time.
Thank you. Our final speaker will be Miriam Fisher.
Good morning, good afternoon. I came to talk partly about accessibility support, maintaining MTA legal commitment to accessibility with elevators, ramps, despite recurring financial concerns. I also want to put in one more vote for congestion pricing and reinstating the mask mandate, just to have that on the record. I want to talk about some things that no one else has mentioned. Elevator maintenance, 25% non-working daily. No announcements or alerts to riders who rely on elevators and can be left stranded for hours. There's the digital capability for warning announcements, and it is not being revised and updated. I applaud the introduction of announcements now on the trains that the next station has an elevator at the front, middle, rear of the platform, but there's no information that the elevator is not working, so the rider can plan and reroute before being stranded. These announcements are hardwired and pre-programmed and not useful to tell people that the elevator is not working ahead. I bring the issue up because nobody else is mentioning it, and I tweeted that quite a few times with MTA response. I'm saying it now here. The subway gates project, $100 million for pilot project for safety gates at 3 stations, when the MTA survey has shown only 25% of stations can actually be retrofitted. It's a waste of money and could go to more elevators and accessibility. To me, it's a public PR to assuage fears about assuage fears, but it's really not useful. Explore safety with the new technology that is mentioned.
Please conclude your remarks.
MTA reports to monitor people on the tracks, to alert train conductors, and this is
Please conclude your remarks.
Thank you.
Thank you. Thank you, everyone, for your participation, for your patience, and most importantly, for your comments. This concludes this month's public comment session.